Countless claims have been flying around social media regarding the vaccine.
Dr. Jeff Pothoff with UW Health joins us now to help set the record straight on a few of the myths that are floating around out there. And we're going to talk about our first myth, Dr. Pothoff, that a lot of people think that once they get that vaccine, they may not have to wear face masks. Can you set that straight for us?
Yeah, we hear this a lot. And, someday the day will come where we don't need to wear face masks. But for right now, with a small percent of the population vaccinated, we still need to wear those face masks because what we don't know is if you get the vaccine, can you still carry the virus? And if you can carry it, you might be able to spread it to other people who aren't immunized. So once you're vaccinated, you wear the face mask to protect others who aren't vaccinated yet.
So let's talk about this. More and more people are getting vaccinated for COVID-19. What about the other vaccines out there? People maybe still waiting to get the flu shot and others. Can you get all of this at the same time?
So the current guidance is, you wait 14 days from your last vaccine before you get your COVID vaccine. And then after you get your second dose of the COVID vaccine, you wait 14 more days before you get your next vaccine. And this is just to give your immune system some time to figure things out. It's possible that if you get vaccines together, they'll still be effective. But, the one caveat to this is if you need a vaccine for something more emergent, like tetanus because you got a cut or rabies because you got bit by a bat, you want to go ahead and get that even if you had recently gotten your COVID vaccine.
Yeah. Now, what about people, doctor, who have already had the virus? Do they need to get the shot? They might think, okay, I'm immune.
Yeah, this is a great question. So what we know so far is it looks like the immunity that you get from the vaccine is actually stronger than the immunity you get from natural infection. So right now, the recommendation is even those people who have tested positive for COVID-19, who had the disease, still get that vaccine because you'll get better immunity from the vaccine.
So that is interesting because that is a question I often hear from people.
Yeah.
So if they already have it, should they be as eager to get out in front and get it as fast as they can, or wait for some of those other folks who really need the shot and haven't been able to get it yet?
Yeah, I think that's a good question, but I think, if you're in a patient population that's eligible for the vaccine, i.e. you're a little bit higher risk, I probably wouldn't wait to go get that vaccine. We just don't know how long that natural immunity will last.
Sure.
The other thing that plays into that is some of these variants are a little bit better at escaping our immune system, whereby they don't seem to escape the vaccine quite as well.
Yeah, just take precautions. Dr. Jeff Pothoff, as always, from UW Health, we appreciate you being with us on our News at 3:30. Thank you, sir.